Before understanding how diabetes works, we should just review quickly homeostasis of a normal person without a disease process. At any given time, your lab values for your blood glucose should be between 60 and 100 milligrams per deciliter. That number will fluctuate throughout the day a little bit as the body corrects itself with an abundance of sugar in the blood that's processed or a decrease in sugar in the blood. And how that body goes about getting that is on this chart here. So first, let's say that you just went for a run, or you did something, or you worked a long shift, and you're feeling a little shaky, just a little low. And sometimes a lot of people identify that as that they just think they need more sugar, which a lot of times will cause us to want to have a snack. But let's say, for instance, that's what you're thinking, but your body's doing something about it without you doing anything. And that is, it is sensing that your blood glucose is low within this value range. So your blood glucose is still normal, but it would go, let's say your average you run is about 80. It would maybe go down to 72, 74, something not outside of the normal limits. That will cause your pancreas to intervene. Your pancreas will get the message that our blood glucose is down. And what it wants to do is get glucose into the blood. And how it goes about that is sending glucagon to the liver. Glucagon is then metabolized, becoming glucose, which goes into the blood, raising the blood sugar, bringing you back to a homeostatic level, which you were pretty much already at, but it's keeping you at that level range. On the other hand, you sit down for a buffet, and you decide, I'm going to eat a super mega value meal with extra syrup and sugar, whatever. You're going to overload your body with glucose. So your body will say, there is a lot of glucose in our blood right now, and we need to get some of that sugar out of the blood. So it'll send a message to the pancreas saying, we need to get this sugar down. And insulin says, I got this. So insulin, picture it as a key. And what insulin will do is it'll combine with glucose like a lock and key. And that will do two things. First, it'll go into the cells. The sugar will enter the blood cell, getting out of the blood and becoming a cellular level storage, and that it can be used for energy. Second is anything that you don't need will get sent to, again, to the liver, and it'll become glycogen. Now glycogen will then take that sugar will become glycogen, and it'll be stored in the liver. So you have all that sugar in the blood. It goes into two different ways. It goes into a cellular level, and then it is stored. Either way, it is out of the blood, lowering the blood glucose, becoming, again, homeostasis. Now, again, anything that you would do would alter that lab value, but the important thing is that is within this range. So even if you will have a decreased blood glucose, you are still within this range. Increased blood glucose, you are still in this range. Your body acts quick. You don't have diabetes. This is normal. This is how a normal body works. If on a test question you have an elevated, it's over 100, then that'll indicate some sort of diabetic process. Under 60, same thing. And that would be hypoglycemia and hyperglycemia if it's over 100. But either way, it's important to know lab values don't change outside of the normal range for a normal person without diabetes.